Okay, today to start out, I would like everyone to close their eyes for a moment and take a deep breath. While your eyes are closed, please raise your hand if you have experienced a traumatic event in your life before you had reached adulthood. Okay, what about if you know somebody who has experienced a traumatic event before they had reached adulthood? Now keep your hands up and open your eyes. Take a look around. That's a lot of people, isn't it? Just in this room alone, a majority of you have raised your hands. According to the Vermont Agency for Human Services, 26% of children in America will either witness or experience a traumatic event before reaching the age of 4. An alarming 11% of girls aged 13 to 17 have experienced sexual assault in the last year, and 4 out of every 10 children in the United States say they have experienced physical abuse or assault during the past year. So, we've heard the statistics, but what exactly is trauma? According to the Center for Nonviolence and Social Justice, trauma is used to describe experiences or situations that are emotionally painful and distressing, and that overwhelm people's ability to cope, leaving them powerless. Childhood trauma can take many forms, including sexual, physical, and emotional abuse, abandonment, exposure to domestic violence, neglect, witness to severe natural disasters, abduction, undergoing medical procedures, and exposure to war. The trauma theory came about in 1970 with research from studies that involved Vietnam veterans, Holocaust survivors, refugees, and victims of sexual assault. This theory brought about the discovery of post-traumatic stress disorder, which was added to the Diagnostic Statistical Manual for Mental Health Professions in the 1980s. Trauma theory explains that individuals who have undergone trauma are not sick or deficient in moral character, but rather injured and in need of healing. Trauma can be in the form of a single occurrence or through a recurring pattern. Oftentimes, once the trauma that a child has experienced is no longer occurring, they are left with physical and/or emotional side effects. Children in which who have experienced trauma often develop post-traumatic stress disorder. You may have heard of this disorder due to how common it is in soldiers returning for war. When trauma occurs, the person often experiences a great deal of stress. Once the trauma has subsided, the person is unable to reduce that stress and continues to experience that fear and anxiety as if the trauma was still occurring. This disorder has a very large range of side effects when seen in children under 18. These side effects include avoidance in eye contact or physical contact, low self-esteem, social anxiety, aggression, agitation, withdrawal, a heightened startle response, difficulty sleeping, problems with ingesting and digesting food, as well as negative responses to sights, sounds, or tastes that the child associates with the trauma they have experienced. Infants and young children can experience regression in toilet training, atypical development in verbal language, and separation anxiety. According to Mental Health Daily, the human brain is said to reach its complete development by age 25. When a child experiences trauma, detrimental effects can occur with brain development. Severe trauma in childhood affects every single domain of development in some way, shape, or form, including social, emotional, cognitive, physical, psychological, and moral development. In the child's future, an insignificant minor stressor may cause the body to react as if the stress is significant and life-threatening. Extreme stress sets off the body's fight or flight response, which increases cortisol levels in the body. Cortisol is a chemical in which can cause abnormal brain development or destruction of brain cells when higher levels are released into the body. Studies have shown that children who experience trauma have an increased vulnerability to infections. Antibodies and infections are said to increase with high stress levels in the body. Early childhood trauma is also associated with reduced size of the brain's cortex, in which is responsible for attention, memory, and the ability to regulate one's emotions. Childhood trauma is a risk factor for disorders such as obesity, depression, substance abuse, sexually transmitted diseases, and nicotine addiction. With the startling statistics introduced earlier in the presentation, and the amount of people in the United States affected by trauma, it is important to have the tools and knowledge to be able to help. The popular phrase, "It takes a village to raise a child," comes into play when speaking about trauma. Children who have experienced traumatic events above all else need a support system that includes people that help the child to gain a sense of safety and security in whom which they can trust. Children need validation that the trauma was not their fault. According to childwelfare.gov, it is important to be able to identify and understand a child's triggers so that the individual can help the child to avoid those situations. Encouraging self-esteem in a child with traumatic background can help them to improve their sense of self, which is often lost when trauma occurs at a young age. Some children who have experienced trauma may benefit from speaking with a skilled counselor trained in the identification and treatment of trauma. There are a multitude of mental health treatment centers in your area. If you are unsure how to begin the process of seeking a mental health professional, goodtherapy.org has options in which professionals can be searched by state or city and provides contact information to set up an appointment. If the child has health care coverage, the member services phone number on the back of the card can be called and the insurance provider can provide referrals in your area in which accept the child's coverage. Trauma can sometimes be a silent struggle for children. The reason for this is that the child may be too afraid to tell someone that something is occurring in their lives, or they may be unaware that the abuse is occurring. There are many warning signs associated with trauma and abuse in a child. Signs of physical abuse include bruising, withdrawn or fearful behavior, and declining grades in school. Signs of emotional abuse include speech disorders, sleeping problems, antisocial behavior, and delays in emotional growth. Signs of neglect include lack of medical or dental care, poor hygiene, lack of proper nutrition, and lack of school attendance. If you feel as though a child you know is experiencing abuse at home, you can contact the Child Help National Hotline at 1-800-4A-CHILD. This hotline is open 24 hours a day, 7 days a week, and abuse can be reported anonymously. Please feel free to contact me if you are interested in requesting further information than what is listed on the handout. A lot of information regarding the topic of childhood trauma was presented today. Please take some time to reflect on this. Was there anything that surprised you? Turn and speak with the person to your right for a few moments to compare comments. Would anybody like to share their findings? I'd like to share a quote to end on, which really brings the effects of trauma into focus. The quote is by an author by the name of Danielle Burnock and says, "Trauma is personal. It does not disappear if it is not validated. When it is ignored or invalidated, the silent screams continue eternally heard, only by the one held captive. When someone enters the pain and hears the screams, the healing can finally begin." If you know anyone, child or adult, that is or has experienced trauma, please validate them. Let them know that their voices are heard and that they are not alone in their struggle. Thank you.